This video will cover documenting subjective information on the progress note. This video will cover documenting current medications as a provider. Prior to accessing the progress note, the user may be prompted to carry forward current medications. This feature can be enabled by an administrator. The setting is found in Practice Defaults. Upon accessing the progress note for the first time, this is the pop-up that will appear if this feature is enabled. Do you want to carry forward current medications for this patient with this encounter date and time? If you click yes, the system will carry forward the medications. If you click no, the current medications will be left as blank and an unknown status. This feature can be useful for existing patients who have previously had their current medications documented. The current medication section can be accessed by clicking on the current medication link on the progress note. It can also be found using the progress note toolbar and the pill icon found on the top left. This section should only be used to keep track of past and current medications. This is not to be used to prescribe new medications. New medications should be prescribed using the treatment window. This window contains 4 tabs: current medications, past Rx history, external Rx history, and unreconciled past medications. If you see the tabs in red color, this is a visual indicator that you should take action on the medications. We will cover that further into our discussion. Before you begin documenting current medications, it is a best practice to see what past Rx history was. Click on the Past Rx History tab. From here, providers can review a patient's medication history from the past visits. Providers can also add medications in the patient's current medication list from the Past Rx History tab. If the patient is currently taking or temporarily not taking a medication in this list, the provider may add this information to current medications by selecting one of the statuses found on the right: T for taking, or N for not taking or temporarily not taking. In this window, you have the option to group the medications by encounter date, medication name, or the provider that prescribed the medication. Click on the plus or minus signs to expand or collapse a group. The medication by visit date will display a stop date if it's available. It will also display any additional notes and the status of either unknown, they stopped, taking, not taking, discontinued, refilled, or to continue. Both medications from the current medications for the patient and the medications prescribed by the provider in the treatment section display under the Patient Rx History tab by visit date. You can also click on the H icon to show the history of a specific medication, such as when it was started, stopped, refilled, etc. Another way to look at the medication history is by clicking on the External Rx History tab. This will retrieve a patient's medication history from an external source using External Rx History tab. Providers can also add medications from the patient's External Rx History tab to the Current Medication tab. Please note that the patient's Rx consent form must be signed and added to the patient demographics. Along with that, Rx eligibility must be checked by the user in order for this feature to work. Once those steps are performed, the external history can then be retrieved. If you click on the Retrieve link, the system will prompt you to check the eligibility before retrieving. Click on the Rx Eligibility tab found in the upper left-hand corner. Then check Rx Eligibility. Rx Eligibility is a feature that works with Rx Hub. If you currently do not have this enabled in your practice and you wish to add it, you can do this through product activation or by contacting sales. Once Rx eligibility is confirmed, you will then set the formulary. Setting formulary is also an important step when prescribing new medications from the treatment window. From this tab, you have the option to check at a 1 month, 3 month, 6 month, or the next 6 months time frame. This section is also grouped by medication or provider. The Rx history details will display the date the medication was ordered. This will display the quantity of the medication prescribed and the duration of the medication prescribed. Providers can add medication from the External Rx History tab to the patient's current medication tab. For example, if a patient was prescribed a medication by their dermatologist and the patient was referred to an immunologist, the patient's immunologist can retrieve that external history and add the medication. They can also use the quick search tool found on the top left to also add it. In another scenario, if the patient stopped taking a medication prescribed by their dermatologist, the patient's immunologist can select not taking status for that medication from the same tab. Another important workflow is to check the last tab, called Unreconciled Past Medications. If this tab is red, the medications present on the list may not have been reconciled previously and may not exist on the current medication list due to deletion or a different method. You should verify the medications with the patient and select one of the statuses. If the medication is already on the current medication tab, then this step is not needed. You can choose to mark them all taken, not taken, unknown, or discontinued. Now that you have cross-checked the past Rx history, you can now begin to add additional medications to the current medication list if needed. To perform a medication search, you will enter the name of the medication in the quick search field found on the top left. For example, ibuprofen. When you start typing, a list of matching drugs will display in the drop-down list. Use the left and the right arrows to view additional drugs if the drug doesn't display at first. Be sure to select the drug with a green check mark next to it. That check mark indicates that an NDC code is linked. This will ensure proper interaction checking and accurate reporting. If you wish to add the drug to your list of favorites, click on the small star found to the right. If you add a medication to your favorite list, you can activate your favorite list in the future by enabling the large yellow star found to the right of the quick search field. If it's yellow, you are viewing only your favorite list of medications. If it is white, you will be searching the entire list of medications. Also, please be aware of the filter option. The blue filter button can be used to display certain Rx types. Also, if you wish to change your search from a start with to contains, you can use this drop down here. You can also decide to show discontinued or inactive medications, or show only dosages that are standard, or my favorite dosages, are both. Please be aware of these different options found in the filter icon, as if a filter is set, it may be hard to locate a medication in the quick search field. When you are ready, select the drug. The Rx Edit window will open, allowing you to select the dosage amounts. When you find the correct dosage, select it. If you do not have the dosage information, you can select the button on the top right to Add without SIG. This will add the Rx name only to the list, as seen here. This would be the same as selecting the checkbox at the top for Name Only, and then selecting the medication from the quick search field. To edit dosage information after you have added it to the patient's list, click on the blue drug name. This will open the available dosage options, if any exist. You can also document the start and the stop date and who the source for this particular medication was. Click OK to save it. After you select the drug, it will be added to your list of medications and grouped by the statuses that you select. Please note, medication interactions must be checked. This button will highlight if there are any warnings. As a provider, you must take action on interactions. Documenting the actions taken on the interaction drug warnings will be covered with the treatment section. If you add the same drug twice with different dosages, such as may be needed for blood thinners or a drug within the same drug class family, the system will warn you. For example, if the patient is already taking Coumadin 5 mg and I wish to add an alternating dose of 10 mg, The system will prompt me saying that it belongs to the same family. Do I still wish to prescribe it? By clicking yes, it will then add it. So you must confirm to add it or not. Anything that the patient is actively taking must be marked with a T for taking. Mark it unknown or U if the patient did not disclose the details, or, for example, if they do not remember. Mark it with an N for not taking if the patient temporarily stopped taking it, such as seasonal allergy medications. If the patient stopped taking it altogether for whatever reason, select the discontinued with the stop date. To add additional notes to the medication, click on the paper icon. This will give you a standard list of keywords to search from, or use the right side window to free text into this field. From this window, the system populates the stop date for any previously entered medication from past encounters. When a prescription stop date is past due, the system removes the prescription from the patient's current medications tab. Stop current medications and medications for chronic issues. Patients with chronic conditions may take certain medications continually. eClinicalWorks provides a configuration option to mark certain drug classes as chronic. If a prescription belongs to a drug class marked as chronic, a stop date will not take effect for that medication unless it is added manually. The user may add a stop date manually. To enter the stop date manually, click on the blue drug name and select the calendar icon to go ahead and add the date. And click OK to save it. To carry forward the same status as the last time the medications were reconciled, use the Apply Status from Prior Visit button found on the top right. You can also mark all as taking, not taking, unknown, or discontinued by using one of the 4 buttons found here at top of the status column. If a medication was added in error, use the trash can to delete it. If you wish to change the order of the medications, so maybe the chronic drugs appear higher in the list, simply select the far left column underneath the arrows and reorder them by dragging and dropping them in the desired order. When you complete your medication reconciliation, be sure to check the Verified checkbox found next to your favorites icon. That concludes this video. Thank you for joining me.